Week 7 is officially over, which means we're done officially day 35. Now, what does that mean? Well, today it just means I had my second full day at my second clinical rotation just because we were at the main hospital for 3 out of 5 clinical days for this week in my program. So, what was that workflow like? Well, to give context, there's 3 sonographers at this location, and one of them does congenital and cardio treadmill stress tests and echocardiograms, like the normal like stress test. And then the other 2 will do normal stress test and, if needed, congenital stuff. So basically got to see the workflows. The person that does the stress test and congenitals, since he's been here the longest, he can see up to 12 cases a day. Then the second longest tenured sonographer will do about 10, and the more newer, quote unquote, newer sonographer will do about 8. But that person has been here for a couple of years. It's just to get more experience. So got to see the workflow. Basically got to see at least one case with each of those sonographers, and that was pretty cool because I got to see the insights into one case each, one in pediatrics, one treadmill stress test, and then a lot of regular stress tests, because I got to see all the different pathologies, seeing what it would look like if there was an actual condition, and then learning more about the characteristics of specific pediatric cases and things of that nature. And the seeing the relationship between the pediatric adult and the sonographer and the cardiologist doctor, just because they've known each other for so long, because that's been the same sonographer and doctor relationship since the pediatric adult now was younger. And I remember recently we had a talk from a pediatric cardiac sonographer who was talking about how there's a shortage of adequate pediatric sonographers that know how to scan when those pediatric kids turn into adults with those cases. Because back then, frankly, they didn't make it that long just because of the technology and there wasn't enough information. But now that technology and everything has improved so much, those kids are having longer lives, which is awesome. But now we need more sonographers that are able to look at the pediatric cases and scan them accurately, because the orientation of the images is all flipped and reversed, so it looks different, and people that mainly focus on adult echocardiograms are going to miss or not have as accurate results as someone that has been familiar with pediatric cardiac sonography stress tests for a while. So that was cool.